The predictions about an Omicron surge this winter are dire. If the latest numbers are any indication, we'll be confronted with the worst outbreak of COVID yet, a viral blizzard. Omicron raced ahead of other variants, and it is now dominant. In the U.S., it accounted for 73% of new infections last week. CDC numbers show a six-fold increase in Omicron infections in only 1 week. In much of the country, it's even higher. Here in the Southeast, it's responsible for 90% or more of new COVID infections. Today at 2:30, the president set to unveil the administration's new war plan. Joining me on the morning show, Dr. Jonathan Kantor, an epidemiologist with the Penn Center for Epidemiology. So Mr. Biden's going to issue a cautious warning, but also be reassuring. That said, a senior scholar at Johns Hopkins put it this way: all of us have a date with Omicron. If you're going to have a life, if you're going to interact, he says, with society, Omicron's something you'll encounter. What's our reality?
Well, I think the reality certainly is that it's something we'll encounter. The question is how significant and how important is it going to be to us? And I think that is where, of course, all the things that we've been talking about over and over again come into play. We're definitely going to be exposed to Omicron. We're definitely seeing that. The dramatic increase that we've seen. I mean, we went from just a couple weeks ago seeing almost no cases in the U.S. You have countries closing borders up to the point now that it is, over 70% of all cases in this country. So that is a crazy rapid increase in terms of the dominance. What that suggests to me and what that suggests to others is that Omicron must have some important advantage here in terms of infectiousness, and that's why it's so important that we take this seriously.
I know people are tired of hearing it, but the best way to encounter this, vaccinations and boosters still?
Yeah, I think the problem is it's kind of like when, mom gives you advice that you kind of hear over and over again, and you kind of are like sick of it. But you know what? Generally, mom's advice is good advice. And I think that's the same thing that we're seeing here. It may be frustrating to hear people over and over again talk about social distancing, talking about wearing masks, talking about getting vaccines and getting boosters. But I think the reason that we're doing that over and over again is because it just makes sense. It's sort of like the idea, of eating your fruits and vegetables. It actually is good for you. It actually is healthy to eat a balanced meal. Same thing here. It actually is good for you to get those vaccines and those boosters. And that's really going to be the solution out of this. And that's going to be the way that you can make that date with Omicron really just kind of like a glancing first date for a cup of coffee, rather than a week-long trip to the Caribbean.
So even though the expectation is it may be milder, there will be breakthrough infections. People without vaccinations may wind up in the hospital. Delta is still a big problem. Healthcare workers are expected to get sick. Is there worry the healthcare system may become overwhelmed again?
Well, I think that's definitely the central concern. If you look at what states are worried about, what health departments are worried about, they're obviously concerned about people getting sick, but their main concern from a delivering public health standpoint is, are we able to handle this wave? And I think definitely concerns have been raised looking at what's going on in other countries that we may be dealing with another situation where we start to really overtax our healthcare systems. That said, that is exactly where those vaccines come in. Those people who have been vaccinated, we know, have much milder disease, are much less likely to need the healthcare systems. And that's why that is sort of our path out of this as well.
All right, that said, professional sports teams are canceling games. Broadway shows canceled. But people are going about their business. More people are getting tested. But fact is, the number of people getting vaccinated is not increasing a lot. How do you change minds at this point?
Yeah, it's very difficult to change minds at this point, right? Because it's easy early on when you're doing a campaign to increase vaccination. It's easy to kind of reach out to give information. What we do know from what the science is telling us is that the reason people at this point are refusing vaccines, it's not usually a knowledge gap. It's not so much that people don't realize that studies have been done that show the vaccines are effective. It's not that they're not aware of the graphs showing that you're, let's say, 13, times, not 13%, 13 times. So that's 1,300% more likely to be hospitalized or to, God forbid, die if you've been vaccinated. So it's not that people don't know that. It's that there is some doubt about the source of the information. And that's where it becomes even more challenging. That's where family and friends, and we see this over again with our patients. Family and friends are so important in terms of people really kind of getting those anecdotal stories and kind of appreciating the importance of vaccination, not only in terms of a public health response, but in terms of how their outcomes can improve as well.
Yeah, and what you're basically saying is, sitting down with them and saying, look, we're going to be visiting with your grandmother, your grandfather, your mom and dad. They have compromised immune systems, and if you're not going to do it for yourself, maybe you should do it for them. Dr. Kantor, thank you. Always appreciate your perspective.